Certainly this is an exciting time with immunizations rolling out in our community. But I do want to state at the outset of my presentation, we do have to recognize that it is still quite some time away before we will get to a point where the rest of the public health measures that are in place at this point in time can be lifted. It will be a significant effort and undertaking to ensure that we can reach the required vaccine coverage in our community to make sure that we are able to interrupt transmission of this disease and to make sure that all of us are protected in turn from our most vulnerable and highest at risk to the broader community where we can hopefully regain and retain some sense of normalcy. And as CEO Baker identified in her initial remarks, this is absolutely what we are seized with as a region, but we are also at the same time continuing to case and contact manage, continuing to undertake outbreak investigations, working with numerous community partners to educate, to engage, to advocate. And so there is still a significant amount of work that is being undertaken together with the development of what is going to be a very significant and large program at this point in time. And I will apologize for any background noise. As you know, the schools are virtual, and so you may hear some children in the background while I am speaking. We'll move on to the next slide, please. So the most important thing that I think everyone wants to understand about immunization at this point in time is where are we going and how is this going to look? And recognizing that this is a significant undertaking that is occurring in a fast-changing and rapidly evolving context, I'm going to basically outline a bit about that context and then go through the overall program from its goals and objectives right down to some of the tactics that we'll be employing. But I want to be absolutely clear. Immunization is bread and butter public health. This is something that we've done year in and year out, through the Universal Influenza Immunization Program, the school program, and certainly with experience previously in addressing pandemic H1N1. And there are a lot of lessons learned and a lot of expertise and foundations, both within Peel Public Health, but also across the regional corporation that we are going to be drawing on and relying on in partnership with our hospital partners, our healthcare partners, and the broader community partners and community agencies that we will be engaging in order to make this work an absolute success. I do also want to state at the outset that we understand that this is ultimately a different disease and a different aim than some of our previous campaigns. So we are also working with numerous assumptions and considerations that may change, that may alter as we see more and as the pandemic continues to unfold in our community. But all that said, this ultimately, represents our way out of what is continuing to be the ongoing pandemic here in the midst of, I'm not really sure if we've hit the height of the second wave in the region of Peel or in the province of Ontario. But ultimately, this is meant to show you the strong building blocks and foundations that we have within the region of Peel, the strong partnerships that we have to ensure that this work can be a whole of system response with all of our various partners in the community, and also really identifying all the expertise and all the various efforts previous that continue to inform our planning and that continue to prepare us as we get ready for this in the months to come. So we'll go to the next slide, please. The first and most important thing is to highlight some of the different roles in relation to the rollout. And as you all know, the vaccine rollout in Canada began in late December with the initial approvals coming from the federal level. And I think the easiest way for me to explain this is the federal government approves, directs, and procures in terms of the use of the vaccine. They then deliver it to the province, which basically oversees allocation, public education, and refined prioritization and guidance in terms of who's getting it, when, and how they're getting it. And then at the local level, we basically take what has been identified. We will also continue further prioritization at the local level but we are ultimately the boots on the ground. We are the ones who, once the vaccines are procured by the feds and decisions are taken on how it's going to be used, it gets delivered to the province, who then allocates it to health units and directs how it should be prioritized. And then we're the ones that are actually meant to go out and make that happen through storage, distribution, and administration, through surveillance and data entry, through working with all the partners that I mentioned before, and then also in terms of reaching our local population through our various channels, communication, outreach, engagement. So that's essentially how it happens. The feds buy it, the provinces allocate and distribute it, and we're the ones that ultimately get it into arms together with reaching out. We'll move on then to the next and I'm sure all of you are also seeing the emergency alert coming on your phone, reminding everyone about the stay-at-home order. Sorry for my brief distraction there. But we will move on then to the next slide, please, which is our local context. So it's important for me to set the stage around how monumental a task this is, but really how significant an opportunity this is as well for the region of Peel to continue building on our strategic vision of community for life, and really the opportunity for us to move forward and return to the things that we very much used to enjoy, armed with the knowledge and the lessons that we have learned during the pandemic. What we have facing us is the need to vaccinate as many of our 1.54 million residents that wish to be vaccinated as quickly as possible. That's the overarching vision. And one of the things that is unique about our local context is that in addition to ramping up this mass vaccination program, which as Janice, as CEO Baker has identified, is going to take a lot of resources and staff, we are also still continuing our emergency response in one of the hardest hit communities in Ontario and Canada. And so there are three things that I would highlight. First of all, adherence to the continuing public health measures is absolutely crucial to supporting success. The lower the rates of transmission are, the easier it will be to push those down further to a point where we can reopen with confidence and we can start to interact again with confidence. Vaccine distribution as well is dependent on a number of factors. Primarily at this time, it is dependent on availability, which is really requiring us to dynamically model all the doses and every doses within priority populations to make sure that we're sticking to as much as possible the recommended dosing regime, to make sure that people are getting the full protection that they can within the priority groups, and then try to figure out what additional priority groups we can add to the process. And there are, of course, other considerations. We know that the vaccine specifications play a role. For example, one of the vaccines, the BioNTech Pfizer vaccine, requires ultra-cold storage. And so for that reason, it has been initially rolled out through our hospital partners, who have done a tremendous job of vaccinating in their settings and their venues. We also recognize the diversity of our community, the broad geography, certainly from very urban areas to rural areas, transmission patterns that continue in our community, hesitancy, which I really think, when I speak about hesitancy, I recognize that people rightly have questions, and we are here to answer them and here to continue affording that confidence that the vaccine is safe and effective, together with public education as to why this is so important, how this works, and why this is our way out. And also recognizing, of course, provincial directives and provincial factors such as priority groups, supply chain, et cetera. All of this will play into our local context as to how our program ramps out, with the recognition that our context in Peel is particularly unique amongst health units in the province of Ontario. I'll move then to our next slide, which is really around shared goals and objectives. So just as we've had throughout the pandemic, our goals of the pandemic response is to save lives, protect the health system, and also minimize the broader socioeconomic impacts of COVID on the community, really trying to balance as much as possible the measures, but also recognizing all the other indirect and direct health impacts that the pandemic is having on our residents. And really the important thing is that this pandemic response has been shared with our health and community partners, health system and community partners for the longest time. Ultimately, though, what is now exciting about our ongoing goals in this pandemic response is we have a tool. this tool can actually really help us achieve these goals and objectives, which is why we are, to the extent possible, going to try to meet or even exceed the provincial goal, which is to vaccinate all Ontarians who want or can have vaccination by early 2021. And certainly if the province has additional doses available or if additional allocations become available and are looking for regions with availability and need, we in Peel are absolutely ready to jump on those opportunities to ensure that we can achieve this goal sooner and more quickly and safely. I'll move to the next slide, please. So this is the structure of the campaign, which really is talking about a whole of system approach. And so within the region, the leadership sits with myself and with our Commissioner of Health Services, Nancy Polsinelli, and together with the support of the CEO, Janice Baker, as well as the entire executive leadership team that is meant to bring to bear all of the resources that can be committed to this on the part of Peel Public Health as well as throughout the region. We also have a health system leadership table, which is essentially like a command or a decision table that will be represented by all of our CEOs from our hospitals, Ontario Health, physician leadership from Ontario Health teams, primary care, and certainly other key health system partners in really trying to think through every aspect of the rollout, whether it is aligning logistics or operations, just making sure that we are all together and singing from the same songbook and making decisions and bringing all of our various organizations' resources to bear, all of our organizations' collaborations and partnerships in the community to ensure the program is successful. And then within the region of Peel, we have obviously a number of different aspects of the program that are intended both to support the planning and the rollout of the program, as well as the actual doing of the doing. Both planning within the region of Peel, as you can see there, but also through the operations team and connections to the REOC, but also with the broader community, and including the community response table, including community agencies and partners. There will be an advisory table that will continue to provide insight around the priority populations as they unfold. And then, of course, all of that flowing down to the various bottom boxes, which really speaks to the whole of system response as to how needles actually get into arms, be it in on-site and mobile clinics, mass immunization community clinics, whether they be drive-through or in larger venues, and then also our hospital clinics, which will continue, to the point where that our hospital partners continue to be running alongside us on all of this, broader community clinics as transmission starts to reduce and virtual care starts to transition back into offices. This is certainly the structure that we are starting out with and are grateful for because it puts us on a very solid foundation. Next slide, please. And this is a slide that Janice already spoke to in her initial remarks to really demonstrate within the region all of the various departments and divisions that have been brought to bear on this project. So in the interest of time, I'll move on to the next slide, please. So just as an update as to where we are right now, Christmas came early this year. We began vaccinating in Peel on December 23rd. The aim of our hospitals vaccinating was really long-term care home staff and also hospital workers that were at the highest risk, certainly folks that are working on the COVID wards, ICU, all those other individuals who are on the front lines. And then on December 31st, a day after we received one of the first shipments of Moderna vaccine in the country, Peel Public Health began vaccinating in long-term care homes. And at this time, we have now, between our hospital partners and our own long-term care campaign, have vaccinated over 15,000 individuals vulnerable and high risk by virtue of their work or their specific prioritization within the provincial framework. And we are well on track to complete vaccinating all of our long-term care home residents and high-risk retirement home residents before the week is through. And so that, as you can imagine, at least in terms of having a first dose in those homes, will make a significant difference in continuing to protect our most vulnerable in long-term care homes and really the situation that has been unfolded there. It's important for me to highlight the third bullet here, and there have been certainly many people that have been reaching out to myself, and I know our hospital partners. At this point in time, just given the limited supply, unfortunately, vaccine is not yet available to the general public. And I'll speak to this, when it might be anticipated later on in my presentation. So we'll just move on. So in terms of as we move towards, as we anticipate that more and more vaccine supply becomes available, it will be very critical for us in Peel to have a understanding of how we prioritize who in our population is going to be receiving the vaccine. Our priority setting framework is not something that we develop necessarily on our own de novo. We need to make sure that we are adhering to Ministry of Health directives, also the provincial ethical framework, and also federal guidance from the National Advisory Committee on Immunization. And we also are considering various other aspects, such as what other health units are doing in alignment with neighboring health units in particular, and also looking at our demographic knowledge of our community, our data, disparities, and disease rates to really zero in on specific subpopulations in Peel and try to identify in the course of prioritizing, and as supply remains limited but becomes more and more available, how we really tease out where our vaccination can have the most significant impact to protect health, really going back to those overall goals about saving lives, and protecting the healthcare system, and minimizing impacts in our community. And so I really want to stress that these decisions will be taken by myself and certainly the Committee of Health Services together with the health system leadership table in discussion, and we will also be seeking input from our partners and community throughout the course of the evolving situation as more and more vaccine comes available. We'll go to the next slide, please. So this shows really, in a nutshell, what I described just at a high level in the previous slide. There are certain disease control principles that are being considered in the course of our deliberations with partners, and there are additional ethical principles, including things like equity, fairness, transparency in terms of the decision-making process, which is why I'm speaking really to the draft priority populations here, that are really trying to guide our initial thinking. And I want to be very clear that the draft priority populations for phase 1 and 2 that have been identified before you, these are at a high level. There's further details, and there's a lot of work that's continuing, a lot of dialogue that's continuing with partners and with community inputs to ensure that we manage to land on a rollout that is in accordance with provincial directives, but also supportive of our ongoing response here in Peel. But ultimately, this framework that you see here, I anticipate will be at least the initial foundation for identifying which groups and which populations, just on what we understand about data, disease risk, transmission, as well as the need to minimize harms and maximize benefits, will continue to be largely the focus while supply remains limited at this point in time. Details on exactly when and how will come in the following months, and that will bring me. That's actually where I'll go to the next slide. Based on the perfect. Sorry, just making sure that the slide came up. So based on the information from the province so far, we know we need to also use various approaches simultaneously. We understand, of course, at this time that vaccine allocation from the province is on a per capita basis. So that means that as vaccines come available and throughout the life of the program, 10% of the vaccines that come to Ontario will come to Peel. So the numbers on these slides are really an estimate of the provincial vaccine allocation that we may be eligible to receive. And you will see that the bulk of the vaccines that are anticipated to come and be made available for broader community vaccination is actually anticipated to come in April through June. At least that's in accordance with what we understand from our provincial partners to expect at this point in time. We are obviously advocating for Peel to receive as much vaccine as possible, given the significant spread of disease in our community, and specifically the implications of ongoing transmission in our hardest hit neighborhoods. But as noted in the previous slide, just given the need to manage supply and demand for the time being, there will be ongoing constant communication about where in the prioritization framework, or what the prioritization framework is, where we are in it, and where available vaccines will be distributed. One of the complications that we know about this vaccine program is that we know that second doses also need to be considered in our planning. So that is part of some of the numbers that we are exploring here. But it's really important to highlight that as we are right now in terms of hospital site clinics as well as on-site clinics in long-term care homes, over the next phases, we're not waiting certainly to get to a place where we have to start. We're going to start small and continue to constantly iterate and constantly build together with our partners. So in early February, we will be opening our first mass immunization community vaccination clinics at 10 Peel Centre Drive and at 7120 here Ontario Street. Recognizing, of course, that availability is a challenge. But then through February and in preparation for April, we will be opening 3 community clinics, one in each municipality, and they will be located at River Grove Community Centre in Mississauga, at Credit View in Britannia. They will be at Century Gardens Recreation Centre in Brampton, at Rutherford and Bodden, and they will also be at Caledon East Community Complex at Airport and Old Church. I want to be very clear that these are just the first 3 that we are planning for at this point in time. Certainly in order to move as quickly as possible, and should supply permit, the intent will be to stand up as many community clinics that are easy to access as possible, while also pursuing other modalities such as mobile clinic options, drive-through options, and then also as disease transmission patterns come down in our community and primary care providers become less virtual, to ensure that primary care and pharmacists, as they always have with other vaccine rollouts, are available to support our vaccination efforts. We'll go on to the next slide, which is really around the overall approaches. And this slide really shows just where doses are being distributed and where they're going to be coming online. So right now, as you can see here, vaccinations occurring in hospitals and in on-site clinics, which are the first 2 rows that you can see there. And right now we're hitting probably about 2,500, or we can probably do more and more doses per day. And certainly our hospital partners are interested in expanding capacity even further. As you can see, 7120 here Ontario Street and 10 Peel Centre Drives are being opened as initial models for our community mass vaccination clinics, but these will be used to operationalize larger sites to ensure that this intervention is available in those 3 sites that I've identified. And we're anticipating that once these are stood up, we are looking at, hopefully, as supply allows, thousands of vaccinations per day, over as many hours a day as we can possibly staff, with the recognition that the sooner we reach coverage targets, the sooner we will achieve a coverage that will allow us to reopen with confidence. And we are also working with our primary care providers, pharmacies within the health leadership table to identify, how we are going to work with them in rolling out vaccination and what their role will look like. So we'll move to the next slide, please. This slide just really speaks to a lot of the details around really the clinic specifications that have been worked out so far, and it's mostly just to demonstrate the significant thinking that has been taken on both by the Region of Peel team together with our partners through the health system leadership team to ensure that all of these various tactical aspects of the clinic rollout are carefully considered and are constantly improved upon as we move towards to implementing our mass vaccination clinics. We'll move to the next slide. We also know that, as CEO Janice Baker identified, our current staff complement needs to be augmented to support these operational requirements around distribution, clinic operations, and ancillary support services. And we are pursuing every recruitment effort in terms of redeploying employees, undertaking recruitment, partnerships, obviously, with various vendors, outsourcing volunteers, and working with our community medical professionals through our governing bodies and volunteers of the hospitals. We are basically pulling as many people to support this effort as we can in our community, and we're not sitting and waiting around. We're just getting people in as quickly as we can. We'll move to the next slide, please. The other piece is, besides just offering the service and besides making sure that there's clinics per day, we do need to push people to who are interested to ensuring that they can obtain the service and get the information that they need. So a strong ongoing communication strategy and active involvement with our community ambassadors is critical to building trust, to correcting misinformation, and overcoming vaccine hesitancy, or rather, I would reframe it as answering questions that residents might have to help reassure and to help ensure that they understand the value and the benefit of continuing to pursue vaccination, especially once supply becomes more available. So certainly a combination of tactics are planned to be used, engagement with partners, regular communication, and also targeting, certain audiences, including high priority communities, is going to be all aspects of the communication plan that is currently being finalized at this point in time. We'll move to the last slide that I have here, which is really around risk mitigation and advocacy. So certainly, this rollout, as I mentioned, while we do immunizations, and this is a critical component of what public health practice is, we do recognize that we are dealing with a very different situation with COVID and with the pandemic. And so we are always keeping a clear eye on what are the potential challenges and risks that are here. For example, in terms of technology and data, and this is by no means comprehensive, but this is just to give you an idea of some of the things that we are grappling with, some of the key priorities that we're grappling with. So at this point in time, provincial vaccination information systems are not currently online or accessible for local public health units. They are online for entry, and they are being used at the ministry level, but we continue to advocate for access to provincial data to inform our ongoing response on the ground. We also know that vaccine allocations to Peel, as mentioned, at this point in time, supply is limited, and we are certainly one of the harder hit communities in the region. And right now, with allocation, it is occurring on a per capita basis, and certainly respecting that everyone across Canada and everyone across the province is really cognizant of the importance of vaccination and where we need to go, where we need to go altogether. At least here in Peel, would there be some consideration given to an allocation that accounts for the COVID situation in our community, the fact that so many of our essential workers continue to keep this remote economy going through the work that they do here in the region of Peel. And so that's one thing that we've highlighted as well, and I know that our mayors will speak to that likely. In terms of resources, certainly leveraging our community resources and ensuring that there's enough provincial and funding support to respond not only to immunizations, but also to responding to COVID-19 in general, because that speaks to the last challenge and risk, which is that we really do need to continue ensuring that the community keeps rates down at this point in time, as vaccine rollout is going to take some time and the number of cases in our community remains high. So with that, I'll move to the last slide, which is really just about our next steps. I want to be very clear that this presentation is meant to highlight at a very high level our overall immunization plan. There is far more detail behind what I've presented today, and I already recognize that I've gone way over my my allotted time this morning, which I apologize. For which I apologize. I'm just very excited about this. The details are all available. We have an overview that is being developed, and which will account for any of the questions and comments we received today. That will hopefully be distributed for further specificity next week. And we are also planning to, at the same time next week, file our regional plan with the province by their deadline of January 20th, 2021. We continue to secure mass vaccination sites, continue to plan for more, and are continuing to source the necessary staffing resources, really with an aim to continue building on the success to date. I mean, 15,000 high-risk workers as well as residents vaccinated with long-term care home and retirement homes covered with a first dose by the end of the week. It's imperative for us to continue moving forward, and we have the strong partnerships, the strong team in the region, and the strong vision to try to accomplish this work as quickly and as safely as possible. So with that, I thank you, Mr. Chair, for your indulgence in the extra time, and I will be happy to take questions from Council.